This is a short video about renal cystic masses. Renal cortical cysts are the most common renal mass. Their frequency increases with age and they are rare in children. Most cysts are asymptomatic and incidentally found. A simple cyst, meaning it has no solid components or septation, is almost certainly benign. Ultrasound is considered the most accurate and cost-effective way to evaluate renal cysts. They are typically found in the renal cortex. The sonographic criteria for a simple cyst include the following: uniformly anechoic, smooth spherical appearance with thin line, well-defined posterior wall that we can see here in these images, and acoustic enhancement deep to the lesion. If all these criteria are met, further imaging or follow-up is not required and the lesion is considered benign. Complex renal cysts may have irregular wall and may contain low-level echoes. The Busnaik classification of renal cyst is a grading system originally developed for CT scan, but it is increasingly used in ultrasound. It uses morphological criteria to divide the cystic masses along a spectrum from benign, which is category 1, to obviously malignant, which is category 4. In these images, this is category 1 Busnaik, this is Busnaik category 2, category 3, and this is labeled as Busnaik category 4. Busnaik category 1, this is cystic, has all benign features of the simple cyst. In category 2, minimally complex with thin septae. The category 3 contains thick irregular septae and calcifications. In category 4, vascularity within the solid components and mural nodules is observed. The use of this system allows the diagnosticians to decide whether a lesion can be ignored or requires follow-up. Parapelvic cyst appears as a simple cyst centrally located within the renal sinus that does not communicate with the collecting system. Milk of calcium is a renal cyst or a calyceal diverticulus. Contains small calcium carbonate crystals that produce an echogenic layering effect on ultrasound. The ultrasound appearance of milk of calcium is an anechoic area within the renal calyx with hyperechoic foci. Hemorrhagic cyst, simple cyst within the kidney or at risk for internal bleeding. Nearly 6% of the renal cyst will become hemorrhagic. As a cyst increases in size, the risk of bleeding also increases. Hemorrhagic cyst can vary in appearance depending on the age of the bleed. On ultrasound, the lesion may appear as a hypoechoic mass with homogeneous low-level echoes or even uniformly echogenic. A hemorrhagic cyst may have a similar appearance to the solid mass but will not contain any internal blood flow on color Doppler. Here there is no internal blood flow signals. Hemorrhagic renal cyst may also develop as the result of trauma. In these two images, we see that this is a complex renal abscess. Small air bubbles are present. In this image, there is a well encapsulated complex mass which shows max echogenicity. Renal abscess is a collection of infective fluid that can form anywhere within the kidney. Renal abscess will have a similar appearance to a complex or hemorrhagic renal cyst. On ultrasound, the lesion will appear hypoechoic with internal debris. The walls of the cyst usually thickened and irregular. Color Doppler will reveal an increase of blood flow circumferentially. Tiny air bubbles may also be seen and produce shadowing. Autosomal dominant polycystic kidney diseases. APKD, also called polycystic kidneys, is an inherited systemic disorder that predominantly affects the kidney and cause them to be replaced by cysts. Ultrasound is usually used as screening tool. The process affects the kidneys bilaterally but may be asymptomatic. Both kidneys will be enlarged on ultrasound due to multiple various size cysts. Normal renal parenchyma will be difficult to visualize. Larger cysts are at increased risk for hemorrhage and may appear on ultrasound as solid avascular masses. Another cystic mass that can be appeared is renal artery aneurysm. The renal artery aneurysm is defined as a weakened or dilated segment of the renal artery that exceeds twice the size of its normal diameter. Renal artery aneurysm will resemble round cystic mass on grayscale images. Usually centrally located within the kidney, the mass may be mistaken for a simple cyst if color Doppler is not performed. On color Doppler, the arterial blood flow should be appreciated, and mostly it is appeared as young sign, which is diagnostic for aneurysms. Thank you.